Hi, my name is Russell Monco. I'm an F&P student. I'm going to be doing your head, eyes, ears, nose, and throat exam today. Is that okay?
Yes.
Let me wash my hands here. Okay, so first off, what I want to do is look at your overall appearance of your head. The contour, the size, the symmetry, and everything looks good. I'm going to move over here, and I'm just going to look at different areas of your head. Look any patterns of hair loss. I don't see any. Let's look at your scalp here. I don't see any lesions or scaliness. Scalp looks good. Hair looks good. Overall texture feels good. Quantity and distribution is good. Skin of your face looks good. I don't see any abnormal discolorations, any lesions. Normal expression of your face. I don't see any involuntary facial movements. Overall hair distribution of your face looks good. Now, I'm going to go ahead and assess your TMJs. So either side looks good. I don't see any abnormal redness or swelling. Does this feel, you have any tenderness here?
No.
Please open and close. Okay, no audible popping or clicking sound, and I didn't feel any. Okay, now we're going to move to your eyes. So, what I want to look at now is just your eyelashes, your eyelids, your cornea, your sclera, your conjunctiva, and I'm just looking for any abnormal swelling, redness, any inflammation, any abnormal drainage. Let me turn it off. So I'm looking down here. It looks good. Looks good. No redness or swelling. Overall, her color of her sclera look good. Eyelashes and eyebrows look good. No dryness or scaliness of that. We're going to go ahead and test your vision a little bit here. I want you to look straight. We're going to look at pupillary constriction and consensual reflex. Looks good. It looks good. We're going to go ahead and test for accommodation. So please look straight for me. Look at my finger. Look straight. Back of my finger. All right, we're going to go ahead and test for convergence. So her eyes should cross towards the center of her nose as my finger gets closer, which it does. Okay, let's go ahead and test your EOMs, your extraocular movements. Please just follow my finger. Okay, her EOMs look good. She has a good range of motion of her eyes. Now we're going to go ahead and move to the Snella chart. This Snella chart, we can stand at 6 feet away. This patient does not have to wear any corrective lenses. So please, with both eyes open, read the smallest line you can.
LTFPH.
Please include one eye and read it backwards.
HPFTL.
And the other eye, read it forwards.
LTFPH.
All right, patient has 20/20 vision, and going off the pupil gauge, her pupils are about a size 3. Now, let's go from her eyes over here to her ears. First off, I'm just going to look at the overall appearance of her ears, see if they're symmetrical. I don't see any abnormal deformities, any abnormal lumps or masses. So we're going to go ahead and palpate her auricle. Any tenderness there?
No.
I'm going to pull up, down, backwards. Any tenderness there?
No.
We'll go ahead and palpate your tragus there. Is there any tenderness there?
No.
No swelling there either. And then behind each auricle, I'm going to look at her mastoid. I don't see any redness or swelling. I'm going to palpate. You tell me if there's any tenderness.
No.
Good. All right, I'm going to go ahead and look at the external ear canal. What I'm looking for here is any obstructions, foreign bodies, normal amount of cerumen, any abnormal drainage. And I don't see any. Let's go ahead and move to the internal ear canal. I'm going to look at her tympanic membrane. And what I'm looking for here is a good pearly gray tympanic membrane as I pull up on her ear. And then the conal light is good. I see that it's at 5 o'clock in the right ear, 7 o'clock in the left ear. The overall contour of your tympanic membrane looks good. I don't see any perforations, any abnormal drainage. And the malleus looks good. Now, let's go ahead and test the fluctuation of your tympanic membrane. This little pneumatic attachment here. I'm just going to pump it twice. It's going to see if we've got a good fluctuation of your TM. Fluctuation of the TM on the right side looks good. And then fluctuation on the left side looks good. All right, we're going to go ahead and do a little bit of a hearing exam. So what I'm going to do is I'm going to do a Weber test, a Rene test, and gross hearing. So I'm going to tap this, put it at the top of your head. I want you to let me know if you hear it in both ears or if one side's greater than the other.
Both.
Okay, good. Now, I'm going to go ahead and do the Renee test. I'm going to tap this. I'm going to put this on your mastoid.
Okay.
You let me know when you stop hearing it, and then I'm going to turn it, and then you let me know when you stop hearing it.
Okay. I still hear it. Okay.
Good.
Okay. I still hear it. Okay.
All right, so AC is greater than BC, which is good. Okay, let's go ahead and move to your nose. Just overall appearance of your nose looks good. It's good in midline. It looks good and symmetrical. I don't notice any abnormal discolorations or lesions. Just want to palpate down here, down the bridge of your nose or cartilage and laterally. Does that feel okay?
Yes.
All right, let me see. I'm going to palpate your sinuses. You let me know if there's any tenderness there.
No.
I don't notice any abnormal swelling. Go ahead and transilluminate your frontal and maxillary sinuses. That looks good. Looks good. And then I'm going to look at the roof of your mouth as I transilluminate your maxillary sinuses. Looks good. And that looks good. Okay, if you would please occlude one side of your nose and blow. Other side. We're just checking to see if your nose is patent. Let me look inside your nose. Okay, good. Septum looks good. I don't see any abnormal deviations of your septum. I don't see any perforations. I don't see any inflammation. I don't see any exudate. It's good and clear. I don't see any abnormal bleeding, polyps, or sores in your nose. Now, let's go ahead and move to your neck. I'm going to expose the bottom part of your neck here. Patient recently had a thyroidectomy, so she does have a little bit of seroma, some swelling there, and then she does also have an incision with some stitching there and stereo strips. But for this exam, she does have a thyroid. So, overall appearance, her trachea does look midline. I'm going to palpate for midline. I don't feel any abnormalities there. Please swallow for me. Okay, I don't see any lumps or masses as she swallows. I'm going to move here to the back of her neck, and I'm just going to kind of gingerly push one side of her trachea over while feeling the other side to assess the thyroid for any lumps or nodules. Then the other way. Okay, that feels good. Was there any tenderness there?
No.
Okay. Now, let me go ahead and palpate your preauricular lymph nodes underneath your jaw, making sure everything's good and movable, no hard masses or nodules or any tenderness.
No.
And then right above the clavicle, postauricular down the neck, and the shoulders. Does that feel okay?
Yes.
Let's go ahead and test your C-spine. Put my fingers here, midline, base of her skull at the hairline, down towards the C1 or T1. Is any tenderness there?
No.
No swelling. Let's go ahead and palpate your neck muscles. Is there any tenderness or spasms of your neck muscles?
No.
Good. Okay, let's go ahead and test your range of motion of your neck. I need you to turn to the left, to the right, look up, look down, and then laterally. Good. Range of motion is a little constricted since the surgery, but overall, it's good. So let's go ahead and look at your mouth, okay? So I'm going to look at your lips, your gums, your teeth, your tongue, hard palate, soft palate, tonsils. Overall, your lips look good, moist and intact. I don't see any dryness or cracking, any sores, anything abnormal. Let's open your mouth here. I'm going to look at your teeth. I don't see any caries or missing teeth. Gums look good. I don't see any white patches. I don't see any bleeding gums or sores. Let me look at your tongue. Please stick it out. Say ah. Let's go this way, that way. Look over your mouth, please. There we go. Tongue looks good. Texture looks good. I don't see any redness or inflammation of the tongue. Let me look at your hard palate. All right. Hard palate has a good color. No inflammation. No redness. I don't see any exudate in her mouth. Let me look at your tonsils. And soft palate. Uvula is midline, no inflammation or redness. And tonsils are symmetrical in size and shape. I don't see any exudate there. All right, yeah, everything looks good. And that concludes our head, eyes, ears, nose, and throat exam.